What's up, bitches? I'm going to talk about COVID again. All right, let's take a quick trip down memory lane. Remember back in June, July, when this whole idea of a breakthrough COVID case, like someone who's fully vaccinated getting COVID, was just out of this world and no one wanted to talk about it? And then when the CDC in the United States changed their policy on masks, then they kind of had to shore up some evidence to say, like, all right, guys, we realize that vaccinated people are getting sick. And they started doing some instant damage control around it by using their favorite tool, the media. The media. All right, so I'm going to draw your attention to a piece of so-called news that was published by Daddy Bezos' rag, the Washington Post. And then I'm going to look at the actual source material that they speak about, and we're going to compare and contrast. All right, Exhibit A. CDC study shows 3/4 of people infected in Massachusetts coronavirus outbreak were vaccinated, but few required hospitalization. That's cool. Not that many of them got hospitalized. The article continues to say that critically, the study found that vaccinated individuals carry as much virus in their noses as unvaccinated individuals, strongly suggesting that vaccinated people could spread the virus to others. What? Okay, so that was the bad news. Let's see what the good news is. Scientists say that the Provincetown outbreak and other recent data on breakthrough infections make clear that vaccines offer significant protection as they were designed to against severe illness and death, but do not offer blanket protection against any chance of infection. Only a handful of people in the outbreak were hospitalized. Okay, then there's a lot of scrolling through this article until we get to the next juicy piece of information that says that they reported 79% of the breakthrough infections were symptomatic. Okay, that sucks. And 4 out of 5 people who were hospitalized were fully vaccinated. Hold on, you made me read this entire article with that title just to get to the very bottom and to realize that in fact, out of the 5 people who were hospitalized, 4 out of them were fully vaccinated. The whole point of this article, everything that they're trying to say, which is that, oh, well, if you get vaccinated, you might still get COVID and you might still spread COVID, but it'll prevent you from going to the hospital. It literally shows the opposite. It shows that the people who were vaccinated were overrepresented in the group that actually got COVID, okay? Not by a lot. So the overall vaccination rate in Massachusetts was about 70%, and 75% of the people who did get COVID in this cluster were vaccinated, right? So they're slightly overrepresented, but guess what? They're even more overrepresented in the group that was hospitalized, okay? So it's actually ridiculous that the whole title of this article and the whole message that they're trying to bring across is actually contradicted by the very study that it's based on. Okay, before we get all hot and heavy, let's move on to Exhibit B, which is the very report that this whole article was based on. And it comes from the CDC's Morbidity and Mortality Weekly Report. Ooh, sinister. Okay, so in the very beginning of this report, it says that in July 2021, there were 469 COVID-19 cases amongst Massachusetts residents who had traveled to the town during July 3rd to the 17th, and 74% occurred in fully vaccinated persons. Okay, so that's a good little summary. Yeah, most of this information was actually included in the Washington Post article. So let's see if we can find any pieces of information that we don't already know. Ooh. For example, one hospitalized patient, age range 50 to 59 years, was not vaccinated and had multiple underlying medical conditions. Oh, okay, that sucks. Obviously it's sad if anybody gets hospitalized, but it is interesting to note that the person that did get hospitalized from the non-vaccinated group had multiple underlying health conditions. Let's see if they say anything about the hospitalized patients from the vaccinated group. 4 additional fully vaccinated patients aged 20 to 70 years were also hospitalized, 2 of whom had underlying medical conditions. Okay, so this means that half of the hospitalized patients from the vaccinated group had no underlying health conditions, I'm assuming. I think if we're really trying to save lives, we just need to recognize the fact that There's a lot of different factors that make people more vulnerable to getting a bad case of COVID or to even catching COVID in the first place. And these factors have very little to do with vaccination status at this point. Okay? I can't speak about a year ago, but let's just agree that starting from July 2021, we have no choice but to recognize the fact that the factors that make you the most vulnerable to having a bad case of COVID is your age, underlying health conditions, and your basic health. And vaccination status clearly has very little to do with it. So I don't think that it's going to yield the most positive result if we just keep focusing on vaccination status. You could speculate all you want about what the underlying agenda is, but all I'm saying is that if we want to be utilitarian, if we want to save lives, then we really have to recognize what makes people vulnerable. I think the Washington Post is doing a great disservice by taking a study like this that clearly shows you that whether or not you were vaccinated, it has very, very little to do with the outcome of whether or not you get infected, whether or not you transmit the infection, and whether or not you get hospitalized. Okay? They took the study and still tried to turn it into an article about, hey, well, vaccination might not help you to not catch COVID, but it'll help you avoid hospitalization, which is just not something that the study showed at all. And I just think it's a great disservice to people. But, again, obviously there's some other forces at play here. But I just want to recognize the fact that if it was all about health and saving lives, then we would be honest and we would recognize the true factors that make people susceptible to catching a bad case of COVID. And I don't even know what to say. Clearly, health is not the priority, okay? Clearly.